Why do I belong to the Speakers Bureau? Why is it important to me? Well, I did see it as a tremendous opportunity to help find a solution for this cure. In my own case, if I had been diagnosed early on, even back when I had carpal tunnel, if patisiran or the other drugs that we have available to us now existed, they would have been able to treat it then, and I wouldn't have the other ailments to contend with. So it's very important to me that the word get out to the medical community so that other patients can be diagnosed at a much earlier stage of the disease.
So people ask me why I'm involved with the Amyloidosis Speakers Bureau, and I have two reasons. One, I really needed to have purpose in life because so much is taken from you when you have a disease like this. And my second reason is I felt that I could be hopefully helpful to other patients with amyloidosis by spreading the word on this disease. I became familiar with the Amyloidosis Speakers Bureau through a fellow patient who was a co-founder of the Speakers Bureau and sadly has since then lost her life to this horrible disease. I was in the early stages of my own journey, and I spent a lot of my time simply trying to survive and try to make something meaningful of what had befallen me in my life, quite unexpectedly. I knew that early diagnosis would be the key to early treatment and the key to survival for patients like me. And it made abundant sense to me that the Speakers Bureau would be presenting to medical students and medical residents who would, after their training period, go out into the medical world into a variety of specialties, which I found intriguing because amyloidosis affects so many different organ systems. And we could get the word out through these students and educate them so that whatever specialty they wound up with, they would always in the back of their mind remember that amyloidosis can affect not just their specialty area, but many others as well, and they can start connecting some dots. I felt strongly that equipped with this higher level of awareness, these medical students and residents would go out into the world and, like my cardiologist, take a step back, look at the big picture, understand what amyloidosis is, order the right tests, get to a diagnosis and treatment before it's too late for patients like myself.
Why do I think my role with the Amyloidosis Speakers Bureau as a patient educator is so important to a medical education? It presents things that you can't read about in a textbook or see on a PowerPoint. It presents the human side of things, the emotion, the anxiety that I went through and all patients go through prior to diagnosis, wondering what's going on. And there's also tremendous emotion when you are diagnosed, when you have to absorb and understand the gravity of the situation. So it's important for doctors to not only have that clinical education, but also have the humanity side of it, the sense of empathy, listening to your patient, understanding what their needs are, both clinically and also as a person, if you will.
Beyond bullet points and dry text, a patient educator brings humanity to the forefront. Patient educator gives the medical community an opportunity to see and to hear firsthand what it is like to have this disease, what it is like to go through sometimes years and many different doctors to get to a diagnosis, what it is like to be treated, and how hard it is sometimes, to stay hopeful and optimistic. It simply humanizes the condition. And I think it's very important in the medical field to have that opportunity to meet sort of face-to-face with the person who has the disease, because nobody knows more about amyloidosis than the person with amyloidosis. And in doing presentations to students and to residents, we get feedback. And I would say two of the things that I've read in feedback from my own presentations, really that move me the most. One is, after seeing my presentation, they know that they will never forget me and what they were able to learn from me as they move forward in their medical careers. And the second takeaway is that they think that having experienced and heard my story, they will be better doctors. And I think there's no greater result in my mind for the effort I put in as a member of the Speakers Bureau.